With the transition date approaching, CEO of La Clinica de Familia, Suzan Martinez de Gonzalez, says they are prepared to take over in providing full mental health services to La Frontera's close to 2,500 patients. She says the biggest challenge has been making sure they have the proper certifications to open.
There are a lot of licensing and certification issues that have to be bridged, but everyone's been very cooperative with this, and so from the state and from the pharmacy, Board of Pharmacy, all of it, we've received the just great cooperation.
This will be the second transition of mental health services in less than 3 years. Dr. Lindstrom, director of the Behavioral Health Services Division of the Department of Health and Human Services, says that there are lessons to be learned from the last failure to help make sure La Clinica de Familia can succeed.
We really were convinced as soon as we got notice that we were going to face these closures that this really had to be about local solutions, and the fact that so many federally qualified health centers have stepped up to the plate. They have an enhanced Medicaid reimbursement system, and they're established in the community. They've been here a long time. Many of the folks you've heard today get their primary care from places like La Clinica.
State Senator Mary Kay Papin agrees the local organizations have a greater chance to succeed.
She certainly understands our people. She understands our community. She understands our valley. And I think that helps a great deal. We also need to make sure, she needs to make sure that we hire very qualified clinicians.
During the last transition, services were cut and many patients stopped receiving care. Suzan Martinez de Gonzalez says all of La Frontera's services will be continued. And once they are sure the transition is smooth, they will look at expanding mental health services to what they once were.
Until we have that full picture and full access to everything, then we can start making decisions with the staff about what direction to go, what are the priorities, where do we have to go first. So we really need to start doing retreats, those kind of things, and having our people from corrections and from the schools part of that. It's like, where do we need to go from there?
In order to help manage services being offered and look into expanding, Gonzalez says they will be conducting programmatic audits at 3, 6, and 12 months to be sure they are running at the right capacity.
We're not a mental health organization, so we need to make sure that we're moving in the right direction, growing in, not growing so fast in areas that we need to reestablish the need, do need assessments, see where, and prioritize that. Where are we going? What are we going to be doing in the next steps? And then again, making sure that the community is part of that all the way.
Ron Gurley with the National Alliance for Mental Illness in Doñana County says he is hopeful that La Clinica de Familia will succeed.
They're really doing it very well. I have great confidence in them. They are a federal clinic along with Ben Archer. They have a very good reputation in the community. They are going to be able to do this. They may not know an awful lot about behavioral or mental health, but they're hiring the people who do know, and I'm very confident that that's going to help quite a bit.
La Frontera has agreed to stay in Las Cruces for up to 5 more months to run the treatment foster care program, while La Clinica de Familia is waiting on a certification. For KRWG, I'm Samantha Sonner.